So first of all, good afternoon, everyone. And thank you for this amazing opportunity to join the panel, but of course, share some of the insights on the burden of cancer in Europe. So when we discuss the burden of cancer, we very much focus on what is most visible to us. Pressure to the healthcare systems, we talk about the budgets, fiscal constraints, but what we very rarely talk about and capture in our conversations is the hidden burden of cancer. And that is really the price of cancer that is being paid outside of the healthcare system, usually incurred to families, societies, but also the burden that is more visible to other ministries than health, finance, social security, and welfare. But before I actually talk about it in more detail, I would like to start with putting up these numbers and probably state the obvious, that despite the progress that we discussed during the first half of the day, what we are witnessing in Europe is still an alarmingly increasing burden of cancer. But I think what is most concerning to all of us is the fact that cancer is being diagnosed earlier in life and is already the leading cause of death among those younger individuals, those who are younger than 65 years of age. If we now take a look at similar numbers for Greece, I believe that we are very much aware of the situation, with approximately 63,000 new cancer cases being diagnosed in a single year. But what we very, very rarely discuss is that this number also means that, on average, every day, 173 families receive the diagnosis of cancer. And of course, the diagnosis impacts the individual, the patient. But we rarely talk about the broader impact to the family, to their spouses, family economy, but also their children and their long-term future. But if we only look at these numbers and think that we are discussing the burden of cancer, we're actually telling only half of the story. Because what we very, very rarely talk about is the fact that cancer also steals our time. And let me illustrate the statement with very recent modeling, the results of the modeling study which we did specifically for Greece, to estimate the number of years that are being lost because people die of cancer, and usually prematurely. So the 35,000 deaths that were estimated for Greece due to cancer translates to Greek society losing almost 650,000 years of life. And that also means that, on average, every person who dies of cancer in Greece is losing 19 years. And of course, some of these years are the years when the person is most productive, supporting the family, earning their salaries. And if we take those productive years and translate those into the monetary value, we can conclude that the Greek society is losing 743 million due to lost productivity. But let me also bring in the positive note. And we have already heard about it in the previous presentation. Not all of this burden that we just discussed is inevitable. 40% of cancers can be avoided through modifying the risk factors that we already addressed today, the ones that we are very much familiar with: lifestyle, environment, but also prevention of some of the infectious diseases that are directly linked to cancer. And this really brings us to the role of prevention here in reducing the burden. And I would really like to take this opportunity today and come back to Greece and quantify the burden that can be largely prevented through implementing, and I mean successfully implementing, primary and secondary preventive measures such as vaccination and treatment. And I would like to use human papillomavirus as an example. So HPV is a very common infection, and if persistent, leads to multiple cancers that impacts both males and females. So our modeling studies show that, on average, every day, more than one individual dies of HPV-related cancers. And over the year, it actually accumulates to 443 deaths. And just to put that into perspective, what these numbers mean. This means that every single year, Greece is actually losing 2 planes full of passengers that we can largely prevent through primary and secondary prevention. And again, this leads to thousands of years of life being lost. And again, if we look at the productivity loss and the monetary value of that lost productivity, people who die prematurely due to HPV-related cancers leads to 25 million euros. And these are the costs that are really rarely seen or discussed by the healthcare professionals, are rarely seen in the healthcare budgets, but they are really very real in terms of GDP, labor market participation, also public finances, when we think about how we can use our resources wisely. So let me conclude with a sustainability perspective, because this is also the topic of our panel today. Green oncology is not only about the environmental impact, it's also about how sustainable we can use our resources, especially if we have a long-term perspective. And with such a large share of cancers that we can avoid, I think that cancer prevention is and should be seen as a long-term investment, which really yields returns for individual, society, but also for the government. And therefore, I'm a very strong believer that cancer prevention is one of the most sustainable cancer policies that we as Europeans can, and to be honest, really should pursue. So thank you very much.
Thank you. Let me put a quick question to you before we go on to the next speaker, who I haven't forgotten. As an economist, I'm fascinated by the accounting that you're doing here, you know, the costs and benefits. You mentioned return on investment of good practice in this area. Could you maybe break that down a bit and give us a bit more detail about how that return on investment accrues?
Yes, thank you very much for a great question, and I think it really fits the theme today. And let's start from the economic perspective, because I believe that's where the conversations usually starts, or actually they need to begin. And in terms of evidence, we have quite a lot of data that already shows that prevention pays off. And let's take Portugal as an example, because we have mentioned it already, and they have a very similar healthcare environment as well. I would like to share the results of the recent modeling study where they looked at the investment of setting up the HPV vaccination program. They have both vaccination for girls and boys, and also really high vaccine uptake. So what they have showed is that for every euro that is being invested in setting up and implementing this program, the society gets 4 euros back, and almost the same amount for the government. And it's not just an abstract social value, because the returns come from the fact that the government needs to pay less for managing the disease. People are healthier, they're working, and to be very honest, they are also paying taxes. Because a healthy person also pays taxes directly, but also indirectly through consumption. But also, we talk a lot about the investments, the returns for the society and government, but we should also focus on the individual level and what the cancer diagnosis does to the individual. So we have data from Sweden where we followed females who were diagnosed with cervical cancer over their lifetime and looked at the impact of the diagnosis. And what we've seen that beyond, of course, the health impact, they had a high risk of being depressed, having anxiety, long-term unemployment, even in situations where they were long-term survivors. Then there are their partners, family economy. They also are impacted by the diagnosis. But what shocked us most was the impact on their children. Because, again, they were more depressed, having more anxiety, and not because they were sick themselves, because their mothers were. And really, we had an opportunity to follow them into their adulthood. And what we've seen was that they actually had a lower chance of attaining higher education. And as we all know, education is related to better health, better perspectives in life. So cancer changes the trajectory not only for the individual, but also for the future generations. And therefore should really be considered when we are talking about prevention, and that this is really an investment, and we should ask ourselves whether we shouldn't ask ourselves if we can afford to invest in prevention, but more, can we afford not to invest in prevention?
Okay, thank you.